My name is Asad Shah, and I'm a resident in general and cardiothoracic surgery at Duke University Medical Center. Today I will be speaking to you about the topic of achalasia. Achalasia is defined as a degenerative esophageal disease that results in aperistalsis of the esophageal body and abnormal relaxation of the lower esophageal sphincter. In regards to epidemiology, it occurs in approximately 1.6 out of 100,000 people. It typically presents between the ages of 25 and 60. The etiology of primary achalasia is unknown. Studies have shown T-cell mediated destruction of the fibrosis of the esophageal myenteric neuronal plexus. Research has also shown loss of inhibitory neurons in the wall of the esophagus, and achalasia is associated with the risk of esophageal cancer. The common clinical presentation includes symptoms of dysphagia, regurgitation, and weight loss. Less common symptoms include chest pain, recurrent respiratory infections, aspiration pneumonia, and lung abscesses. Diagnosis is made by three main studies. The first is a barium esophagogram. This contrast study demonstrates esophageal dilatation, aperistalsis, and impaired esophageal emptying. There is symmetric tapering at the gastroesophageal junction, resulting in a classic bird's beak image. The second test used to diagnose achalasia is esophagoscopy. This demonstrates retention and a tight gastroesophageal junction. This test must be performed to exclude malignancy in these patients. Lastly, esophageal manometry can be used, which will demonstrate incomplete or failed relaxation of the lower esophageal sphincter and aperistalsis of the esophageal body. The goals of treatment for achalasia involve symptom relief, improved esophageal emptying, and the prevention of megaesophagus. There are some medical treatments for achalasia, but most do not work well. Calcium channel blockers and nitrates have been used to relax the smooth muscle of the esophagus, but unfortunately they provide incomplete symptom relief. There are endoscopic therapies that can treat achalasia. Injection of botulism toxin into the muscles at the contracted lower esophageal sphincter can result in relaxation and more relief of symptoms. However, the results of this therapy are temporary, and moreover, botulism toxin injection makes future surgery at this site more difficult. A second endoscopic therapy for achalasia is pneumatic dilatation. This results in placing a balloon into the narrow area at the gastroesophageal junction and expanding it, providing dilatation to that region. As one may expect, this is associated with a perforation rate of approximately 2%. Some studies have shown equivalent long-term outcomes compared to surgical myotomy, although others have shown more frequent failure of therapy. The surgical treatment of achalasia involves a myotomy. This involves incising the muscle fibers along the distal end of the esophagus at the gastroesophageal junction. This results in relaxation at this tight location. Myotomy can be performed through a variety of means. It can be performed transthoracically through the chest, transabdominally. Additionally, it can be performed with the traditional open incision or through laparoscopic incisions using cameras. The laparoscopic procedure is termed a Heller myotomy and is the most frequent surgical technique used here. Additionally, myotomy can be performed through thoracoscopic means using small cameras placed through the chest. Surgical myotomy is associated with excellent outcomes, including 90% symptom improvement. As one may imagine, releasing the muscle fibers at this portion of the esophagus may result in gastroesophageal reflux disease. To prevent this, one can add a fundoplication or wrap around the distal portion of the esophagus to reduce reflux. In summary, achalasia refers to the aperistalsis of the esophagus and abnormal relaxation of the lower esophageal sphincter. Patients typically present with dysphagia. Diagnosis is performed with a barium esophagogram, upper GI endoscopy, and esophageal manometry. Treatment involves typically pneumatic dilatation or surgical myotomy, which can typically be performed through laparoscopic means. Thank you.